Economic benefits of Accessible Information Standard (AIS) and its impact on quality of life. Gemma is a carer for her parents who are both deaf and use British Sign Language.
As a carer, there's sort of a bit of an expectation of what it is that I'm doing. I do a lot of taking them to and from appointments, and then also when my parents receive like letters or emails and things, sometimes they don't necessarily understand it, and so I'll have to sort of translate it and read through information for them and sort of sign it back to them so that they understand. They expect me to be the interpreter and sort of turn up and sort of drop my work day or whatever I've got planned to go and be the interpreter.
On average, how much time off work and/or cost do you incur when supporting your parents' health appointments?
In the past year, I've taken a total of 4 working days out of work, and that's just the ones that I've noted down. The support that I provided before and after work, of making phone calls during my lunch break. Realistically, it's a good probably couple of weeks a year of time that I spend supporting my parents. For recent appointments in the current work that I'm in, I have still been paid to have time off work, but there is other costs that have been involved. So for example, the fuel cost, driving back and forth for appointments, like just to go to my parents' GP practice, that's 5 miles round trip to go from my house to pick them up, to go to the GP, drop them back off and go home. And go to like the hospitals in Leeds, that's like 20 to 25 miles. To go to Harrogate Hospital, that's 70 miles. And so, it's burning through a lot of fuel. I've then had to pay for parking as well on top of that. And parking in Leeds is not exactly cheap. So yeah, it's added cost just to take them to appointments.
Can you share an example where better AIS would have saved you time?
My mum recently had an appointment where she was diagnosed with cataracts and told that she needed surgery to sort of remove the cataracts from her eye. And there was no BSL interpreter for that appointment, and so there was a massive misunderstanding about what the next appointment looked like. She was given loads of information, like a whole booklet of information, and I spent a long time then having to read that booklet, having to translate it to her and reassuring her that things would be okay if she had the surgery. But it turns out she didn't even have the surgery, she just had like a follow-up appointment. So that could have saved a lot of my time and a lot of stress for my parents, thinking and preparing to have surgery when really that wasn't the case.
How has unmet AIS affected your overall health and well-being?
So being a carer really affects sort of my work and personal life. When appointments are unexpected, then I can't plan that into my schedule. The work's still there. It's really sort of taken its toll on my own like mental health and well-being. Like sometimes when it's like a really heavy week of sort of stress at work and then having to care for my parents and sort of manage my own personal life, my personal life does end up slipping. It's very stressful. I've been like on antidepressants for over a year now, and to be honest, I wish that I've been on them for longer, because I've spent most of my life just horribly depressed and anxious because I have to be a carer.
How could better AIS save costs for the healthcare system? 1. It could help avoid missed appointments.
My mum did miss a couple of community physio appointments. A physiotherapist and an interpreter came out to my mum's house. Like, she just missed these appointments because they never actually told her that she had an appointment. So she just wasn't up and ready to, have the appointment. So they ended up posting a letter through her door saying that she's been discharged from the service from missing the appointments, which was really frustrating because she didn't even know that she had the appointment. So I ended up having to then spend more time making a formal complaint with the Leeds Community Healthcare Service to try and get my mum re-added back to community physiotherapy.
2. It could help reduce duplicate appointments.
There was one appointment that my mum went to, and I sort of stepped back and I said, can you make sure that they book an interpreter? And she had the appointment. And then the following week, she had another appointment where they asked me to attend because they couldn't get an interpreter. And it turns out that first appointment, the interpreter never showed up. So when we came around to the second appointment, My mum had no idea what was said in that first appointment. I had to ask the GP to then go back over the notes from the previous appointment and actually explain what was said in that appointment so that my mum could understand.
3. It could prevent treatment delays, which could lead to more complex interventions.
For example, the diabetes service, like that service has actually been really good. They've been really on it in booking interpreters. But the first point of access was they sent a letter saying telephone this number to book your first appointment. And that was the reason why my mum's diabetes has gotten so bad, because she never got to book that first appointment. And I had to then intervene for my mum to then see that service. But she could have seen that service 10 years ago and she wouldn't be quite so bad as she is now. She might have better managed her diabetes.
How could better AIS make a difference for you, your parents, and the healthcare system as a whole?
One thing that would have been really simple is if there's my parents have an appointment and they put it on a letter, also include that whether or not an interpreter has been booked. Just to have that information would save a huge amount of time, and also just reduce the stress for everyone. It would also be useful if services provided information in sort of an easy, more digestible format, because the amount of appointment letters that my mum receives and she doesn't understand, but also I'm also dyslexic and I also struggle to read. If appointment letters were a lot clearer, then maybe my mum could understand it without me. In the future, I'd hope that my parents are able to just, access health and care appointments. I mean, it'd be quite nice to actually have parents for once and actually have a relationship with my parents and not just sort of be their admin assistant or communications person.
Thank you, Gemma, for sharing your experience. Produced by HealthWatch Leeds in collaboration with Ro Lara and Elsa Guidon.